Welcome to the DNA Talks podcast, where we take on the mission of unlocking the code of your genetics. This season is all about you, upgrading your health, not just on the surface, but down to the root cause. Join us as your clinicians at the DNA company investigate your DNA and beyond. The intention of this podcast is to enhance your lifestyle by changing what is in your control. This does not substitute the medical advice given by your personal doctor, therapist, and other healthcare professionals.
For those that can't see it, I was just doing a victory dance because we discussed in the huddle the concept of dancing in. And there were several naysayers that said healthy masculine cannot dance in. And Justin, always defining what the beautiful of masculine is, here you come dancing in.
You got to be comfortable in your skin, folks. That's just that.
Sir. Yes, sir. Yes, sir. Yes, sir. And I love it.
I'll tell you, I got to say, dancing can relieve a lot of stress, a lot of that nervous energy. So, which is perfect for the topic we're going to be talking about tonight.
That is very true. So welcome to our presenters. Welcome to our audience. We welcome you all. And we're here to talk about cortisol, the good, the bad, and the ugly, and all that is in between. It's such a time to pause and reflect, and hopefully as well take a little bit of respite from things that might be stressing you in your life, or for perhaps, I know family is sometimes can be stressful conversations around those tables. So maybe today we'll be able to educate you as to what part of that stress reaction is and what we can do about it. Why don't we kick it off though with why we are all gathered here today? Cortisol. Who would like to take the first opening question as to what exactly it is and why do we care?
Well, I could always put my teacher hat on.
All right, Miss Teacher, let's hear it.
So let's dive into the nerdy scientific aspect of it, and then we can get to a little bit more of the practical. Okay, so cortisol, I'm sure most of you have heard of it, and it's like, okay, what is it really? I know it stresses me out, but really what it is, it's a steroid hormone. Yes, it is a hormone. And yes, there are tests out there that will measure it and that we are going to be talking about. But really, it is a hormone that is produced in the adrenal glands. And you're probably thinking, okay, I've heard of those. Where are they? They sit on top of your kidneys. All right. They, kind of little tiny things. And they're sitting up there. And it really, their main job, and they are primarily regulated, first of all, they're regulated through the HPA axis. That's the hypothalamic in the brain, pituitary, also in the brain, and the adrenal axis. So HPA axis, and that's often referred to as that stress hormone due to its very important role in the body stress response. So it's usually released in a very rhythmic pattern. And actually, I know Justin is going to be talking about this in a more practical sense in the testing. And generally in this rhythmic pattern, levels generally peak earlier in the morning, gradually declining throughout the day. But really it's like, okay, so what is it supposed to do to me besides stressing me out? Well, it's got a lot of functions, okay? It helps with metabolism because it helps to regulate blood sugar levels. It actually stimulates what we call gluconeogenesis, which is that new glucose production in the liver. It helps to break down proteins and fats to provide that energy. Works in the immune response. It actually helps to suppress inflammation, modulates immune activity, or even prevent any type of overreaction. And I'm sure you're thinking to yourself, but wait a minute. Stress, immune system, isn't that usually causing more inflammation? Yes, but that's when it becomes more chronic. I remember we were talking about the importance of particular hormones, things in our bodies that, yes, there is like this sweet spot that they are doing their jobs the way they should be. But once we start moving outside of that beautiful homeostasis, that perfect area that it works so well, that's when we start getting into trouble. And that's cortisol is the same. In that stress response, that fight or flight, we want that. If there is, say we're walking and all of a sudden, like we see a bear say we're hiking in the woods and we see a bear, yeah, you better want to have your cortisol spike to be able to get ready to either, play dead, fight, scared, something to get your body ready to be aware. But you want it to get back to baseline. It is when our bodies don't recognize the difference of that fear, that thing that is putting us in that fight or flight state is not truly a threat, and it does stop. So that's where that tends to work. And we'll start working in a little bit more about what cortisol does, because other areas, it works for blood pressure regulation and electrolyte balance and in the circadian rhythm, which we'll get into a little bit more. So, it does a lot of things, and it's very, very important. So actually, I'm going to kick the ball to maybe Justin about, why cortisol is so important, as far as like maybe diving in or unpacking a little bit more of what I was talking about.
Yeah, so there's this tremendous ancestral mechanism at play when it comes to cortisol. Cortisol will save your life, to Dr. Laura's point, right? It's there for a reason. When your brain perceives stress, and I'm going to highlight that word perceives stress, because that'll be relative to 2024 cortisol versus primordial cortisol here. When your brain perceives stress, the cortisol will actually go to your liver and release glucose, blood sugar, so that you have some energy, right? Some fuel to get away from that predator. It's also got pain-killing effects in case you get bit. It's got anti-inflammatory effects, like Dr. Laura said, because the binding globulin will take it to different inflamed tissues, because you feel that stress and maybe you got injured. You were running from a predator and you tripped and you hurt your ankle. The cortisol is doing a lot for you, and it's a very good thing. The other primary thing that cortisol does is it's this master regulator of circadian rhythm, right? Our ancestors, it's a very catabolic process surviving the day, right? You had to get up and you had to hunt and you had to gather and you had to make shelters, and it's a catabolic process. This process should take place during the day, right? We're not the type of species that does active things at night. We're supposed to wake up with the cortisol. That's why it peaks around 6 a.m. We do all of our catabolic work, and then it's supposed to suppress, and it's supposed to go down in the evening with this subsequent rising of the three most anabolic hormones so that we can restore and recover. Those being melatonin, growth hormone, and then testosterone. So it's this elegant thing that our bodies are just hardwired to do. We rise with the sun, and then we go down when the sun goes down. We work, we play, and then we go ahead and rest and recover. The problem is we've taken this acute hormone that is beautiful and useful, and we've turned it into a chronic hormone, because we have all of these disruption factors now, right? We get home and we're supposed to be transitioning to the evening time. And what do? We go on our screens, we watch inflammatory news articles and different things, and it kicks on the cortisol mechanism again. If your cortisol goes up, now the melatonin can't go up along with it. It has to stay suppressed, right? So we've got all of these downstream effects, sleep issues and DHEA going down. We don't have as much sex hormones, and it's causing a lot of problems modern day because we've disrespected the ancestral mechanism.
Yeah, no, I think I like that both of you have really highlighted the duality of this, along with the duality, Dr. Varden, to your point, in the sense of most hormones have duality. We want them in a sweet spot. And the moment they're out of that, i.e. we don't have enough or we have too much, that's where it becomes problematic, because to Justin's point, we're this beautiful rhythm, this beautiful symphony that changes throughout the day. And we can always hear when an instrument is out of tune because it causes other sorts of disruption. So I know one of the more popular, and I wonder if we can pause here for a second, one of the more popular things that I see coming across my clinician desk when people seek me out as a doctor, they're like, my HPA axis is off. I don't make any cortisol. This is problematic. I wonder if we can unpack that, because I think people come in sincerely, and really what they're saying is, I'm exhausted and I'm stressed and things aren't working. And so I know it's because I've been stressed for a really long time. But I think what a lot of social media and other avenues have done them dirty is the sense of not properly explaining what they're trying to communicate. So can we talk a little bit about the HPA axis and kind of this idea of adrenal fatigue? Because a lot of you guys see it all the time. People come to us and say, I'm not making cortisol, I have adrenal fatigue. What are they really trying to get at here? What are they a little bit misinformed about here?
Well, I mean, honestly, the adrenal fatigue diagnoses, it really, first of all, lacks robust scientific validation. I mean, as like a standalone medical diagnosis. And it's almost like a symptom where it's more a description of this cluster of non-specific symptoms that people have. If they're having, say, brain fog or fatigue or low energy, then they automatically jump, adrenal fatigue. But the thing is that really it's such an oversimplification for such a complex regulation of the HPA axis. And, one of the major reasons why that, and I call it more of a theory, adrenal fatigue is flawed is because, as you were saying, Dr. Krista, the adrenal glands, they don't wear out from producing cortisol. I mean, even under chronic stress, they can still continue to function and secrete the hormones needed.
And we're qualifying this here, right? We're talking about people who have not been to a doctor and diagnosed with either Addison's or Cushing's. So let's qualify this conversation.
Right.
There are sincere medical conditions.
Yes.
You just straight up are making too much or not enough, or there's a lot going on. We're talking about people, though, who have kind of been through that gamut. It's demonstrated. They're doing A-okay. There's not a medical diagnosis. They're kind of fitting in this no man's land of kind of a syndrome, right? A stress syndrome. So that's what we're specifically talking about here, right? So people coming in, go ahead.
Right. And I did want to say, like you were saying, Cushing's and Addison's. Well, for example, Addison's is an adrenal insufficiency. And that usually occurs due to like autoimmune, issues. So, if some people are being like, well, what's that? Well, that's basically what that is. But yes, and thank you for that clarification, because we are so quick to jump to these, larger descriptors of, what's going on. But, chronic stress doesn't necessarily result in adrenal dysfunction, but it can dysregulate the HPA axis. And that dysregulation affects cortisol secretion patterns. Yeah. It can like flatten it out or invert it, that diurnal cortisol rhythm, like what Justin was saying, where normally you want it to peak in the morning, start coming down at night, but it can actually flip-flop. And that's why people end up having insomnia. And, they can't get to sleep and in the morning, and then they're exhausted, or they just don't have that, the energy to do what they want to do. So although the symptoms can be attributed to the quote unquote adrenal fatigue, there's really, I think, a lack of possibly diagnostic criteria to standardize, those types of biomarkers. But either way, actually, I really would love to have Justin talk a little bit into this and what he has seen, and also getting into some of the diagnostic criteria, ways of testing cortisol.
Yeah. So one of the funny things is that, Addison's and Cushing's, it's like, I think when people do that testing, and if a doctor has identified you don't have either of the above, that you're just normal and it's in the normal range, right? Doctors have a tendency to do that because that's just the tools that they have at their disposal. I think that when it comes to HPA axis, first of all, there's more than one, right? There's HPA thyroid, there's HPA gonad, there's quite a bit going on with the HPA. And the diagnoses of adrenal fatigue is a funny one because the symptomology can be really varied, right? Like there's so many things that it could manifest as, but very rarely is it the gland itself malfunctioning. And the adrenal gland itself is also very complicated. There's 3 different zonas in there. They do different things. One of the things that there's kind of a cascade going on here is that when you perceive a stress, and modern day, that could be eating the wrong food, right? You could take in a lectin or something and your body goes, oh, there's something toxic to that stress or whatever it is, right? So we've got these stressors. It kicks on something called the reticular activating system, the RAS. That
You're
kicks
fancy,
on.
sir.
I know, because I'm really super smart.
You are.
And that goes to a location in the brain called the locus coeruleus. Then that communicates with the HPA axis, right? So there's this big long cascade that goes on to ultimately land you with cortisol. That particular zone in the brain, the locus coeruleus, also releases norepinephrine, otherwise known as adrenaline, at the same time. So when this mechanism gets exhausted, the HPA axis can actually become fatigued in and of itself, for lack of a better word. Your brain can still release a lot of adrenaline when you feel stressed, but it's not being countered anymore by the cortisol, right? The cortisol is low, but the norepinephrine is still elevated. So it can cause further feelings of anxiety and stress and different things. And if you have chronically low cortisol and it's not due to an actual deficiency in the adrenal gland, that's a sign that you're at a later stage, perhaps, with stress. Like maybe you've undergone just a brutal divorce or something like that, and you've been really stressed for a long time. You may have had chronically high cortisol for a period of time and then tested later, and now it's chronically low. Go to your doctor and he says, oh, good, you have low cortisol. But it's because there's a breakdown in the overall mechanism, and it can be a problematic phase. So be aware of that if it's chronically low.
Yeah, I think this really where, especially when working with a clinician to assess kind of in the murk that is anything stress related, having a really good history and a really good retelling of here's what happened and here within my body is what I felt becomes really important, because a lot of where the birth around the idea of adrenal fatigue and the idea of, oh, I don't make cortisol came from was work back in the 70s, 80s, 90s that really started to identify different stages of burnout and exhaustion in people secondary to stress, right? That was first identified. So just as we talk about like with the thyroid, if you have thyroid problems before you actually have a frank hypo or lack of thyroid function, you're going to see a seesaw. And so a similar thing will happen in some of this cortisol patterning. And so there's an element of the history that is taken is very, very important. So when working with your clinician or when you think you're going through something that has to do with stress or a cortisol response, having a really good record of what happened can become really important in the diagnosis, because a lone marker of cortisol by itself may not be helpful by itself. Again, it's more that storytelling. Yeah. And I want to, Justin, I want to pick your brain a little bit here around cortisol testing and how can people go about truly assessing cortisol. I think, and I would imagine, Dr. Lara, I think in your practice, Justin, in your practice, we can all agree that, you know, when it comes to stress reduction or directly addressing this, right? Every person is different. And even knowing the three of us, if one of us was struggling with cortisol, the to do about it, how do you address it for each of us would be so very different, so individualized, because we all have different genes and we all have different experiences within the world. So it's definitely not a one size fit all of like, go become a Buddhist monk in the mountains and meditate it away. All right. So back to the task at hand. Justin, do you want to talk a little bit around testing? How do people, I guess, typically, what's the foregone thought of like, hey, I'm going to get a blood test? Is that helpful? And if not, what else might be helpful?
You know, I think that one of the main things to remember with this is that we're not really trying to quantify just the totality of the cortisol. It's not so much about volume as it is about rhythm and patterns, you know, as Dr. Laura said. It's going to be high at one point in the day and it's going to be low at another point in the day. And that's absolutely fine. There's also a difference between blood versus spit. I'm more of a fan of a saliva test because some people are scared of needles. You know what I mean? Let's be honest. If you're one of these people that has the anxiety surrounding blood draws and you get that to see what your actual stress hormone marker is, guess what it's going to do, right? Also, an at-home test versus driving to a lab, because let's say you have to get up early to take your morning measurement and you drive to the lab and someone cuts you off. And there you are at a red light swearing back and forth with somebody, and then you get your cortisol tested 10 minutes later. Dr. K knows all about that. Your cortisol is going to be way up, right? And so there's an acute response that happens with cortisol that we need to be aware of. So I favor doing it in a little bit more of a calm and structured environment. Typically, if you're going to get it done, you would take 4 different measurements throughout the day. right? So you would do an AM measurement, preferably around 6, 7, when it's supposed to spike. If that one's low, that's an indicator of lots of stuff, right? That's when you want the higher measurement there. You take another one afternoon. Remember, it should be on its way down, that decline. Then you take another one, noon, afternoon, and then night, kind of evening and then night. And then they'll usually take a sum, right? So they'll add it up and they'll see what the totality actually is. But again, that's not the most important part. It's the rhythmicity of it. What's it doing? What's it look like? Now, medications, caffeine use, what time of day are you working out? There's a lot of things that can impact what that rhythm looks like. So I recommend doing it a few times, right, to see the average. What's it really doing? The other issue with cortisol testing in general is that it's based on this population thing. So they could test the monk living in the mountains, and that's incorporated into their data. Then they could also test the ER, the person who works in the ER, and the meth addict that they're actually reviving. They'll test that person's cortisol too. And all of it gets incorporated into this data. And what we end up with is this huge, big spectrum that's all considered normal, right? So if you test within that spectrum, which is way too big, in my opinion, you're still considered normal. And you could be really low in the morning and really high in the evening, but still in the normal ranges. It doesn't give you a good, accurate measurement, in my view. I would rather compress those measurements a little bit and just remember what that rhythm is supposed to look like. So if it's higher in the AM, lower in the PM, you're probably doing okay. If it's chronically high, you may be in an acute phase where you just have a deadline at work and it's still elevated all day long, or medications or what have you. But pay attention to the rhythm and then do it the right way. I recommend saliva. Try to do an at-home test if you can as well, to not skew the numbers.
Yeah. Now I wonder thank you for that, Justin. I really appreciate that. In particular, that the word you use, rhythmicity, I'm going to use that moving forward. But I think really the emphasis and the idea that it's not one time. It's not only going to be across the course of a day, but to our point before, history taking of, you want several tests because one day won't show it all. I wonder if at some point I want to start talking to different genes and how different people might be a little bit more sensitive to stress and therefore, should be a bit more vigilant around this idea of cortisol imbalance, right? But before that, I wonder, maybe Dr. Varden, if you can start us off, I wonder if we can explore a little bit. So your cortisol is off and it's been off for a while. To maybe, in Justin's example, you've been through a divorce, which is harrowing on heart and schedule and body and all the things, right? So you've gone through this long stress, right? Let's talk about the different tolls that can take on the body. And I'll qualify this by saying this is not a diagnostic checklist of you must have all of the above. There's an element of cortisol exhaustion, cortisol dysregulation will show up differently. So we're going to kind of talk to different areas that it will impact. Dr. Varden, any preferences to which area, knowing there's so many little apples to pick from here?
Yes, there is. If we are talking about, well, let me put it this way. If I had a patient sitting in front of me, a client sitting in front of me, and totally stressed out, and actually I've had several of them, it's trying to find out, first of all, what's going on, telling their story, because a lot of times people bottle up the frustrations, the stresses, and there can be many in many different forms, fashions, and ways. Okay. And this isn't just a, psychological, mental. There can also be physical stresses in different ways. Say that person is over exercising. Okay. Not allowing their bodies the time for recovery. And then throw on top of that deadlines at work or, travel. They're doing a lot of traveling. They are getting ready for the holidays or having the financial, things. A lot of times being able to almost word vomit their story, just decompress, take that little pressure valve and just start allowing it to let off, some of that steam. helps to kind of calm things down some. And then we can really start working on what is the most impactful thing? Where do we really need to start? And, when we're talking, I had mentioned earlier about all the different areas that what cortisol affects, affects the metabolism, the immune system, your basic stress response, blood sugar, electrolyte balance, circadian rhythm, all of these different things. But really, it's getting down to the root cause of what is it that is causing such a massive chronic response. Because there can be, your phone making notification chimes and people are just like throwing their phone, and it's like, okay, that is not the root cause of that stress. That is a trigger. That is what is, poking that bear that's already pissed off. So it's finding out what is it basically that has pissed them off that is really problematic. And actually, I was noticing in the chat how Faye said healing traumas, stress, beliefs, emotions, all of those things, those are the underlying causes. Those are the underlying issues that really ultimately need to be addressed for everything else downstream to start balancing out. So, when you can start working on some of that, then you can also start giving techniques, breathing techniques, vagal tone activation exercises, or even vagus nerve stimulation devices, something to start calming that nervous system that can really help reset that nervous system.
Yeah. And I think to your point, it's so very important to have a practitioner that you can communicate with properly and are able to explore kind of the root cause and explore addressing it, right? Because I think, as we're going to articulate, cortisol impacts so many different systems within the body, right? It will dysregulate so many different systems. And so having a practitioner that's not only willing to work with that system, but ultimately, to your point, get back to root cause so that can be adjusted. That's some pretty big work, right? And so feeling comfortable with the practitioner, just like I said, probably all three of us would have different techniques to reduce cortisol, right? All three of us probably might need different personalities or different supports within our practitioners to get to a point where we can address root cause. Yeah.
I think that a really important point here as well is that, like, your brain does not know the difference between a real threat and a perceived threat. And that's really, when it comes to like ruminating thoughts and different things, it's really that reticular activating system will get kicked on the exact same way based on you reliving an argument you had in third grade. And I should have said that to the guy, right? That's the same thing as if an actual predator literally jumped out of the woods and went after you.
Well, it's just kind of like when people try to connect the dots with, like, why does high sugar food, independent of the impact on my body, why does high sugar food bother me, right? And that's because it will raise your blood sugars and then they will crash, and your body is not aware, like your body does not have the cognitive ability to be like, cool, blood sugar here, that's why I feel off. All it knows is there is a drop, and the body experiences that as stress. And that's what then you then feel that as stress or anxiety. And so I think, Justin, you're making a really, really beautiful point in that, a mechanism that used to be so helpful, identifying a bear, okay, cool, we got to deal with the bear, which now can, to your point, be brought about by a memory of grade 3, or maybe I finally indulged and had that delicious sugary thing, and now my body's like, yo, what'd you do to me? Right? That's important. So what though are the physical impacts of chronically dysregulated cortisol? So for our person who's been through that divorce, it's been a year in the making, they're exhausted. What are the impacts to health that they should be mindful of that maybe will bring them to the doctor's office, or that we ideally want them to go to the doctor's office now versus, when they're actually problematic? How does cortisol impact our day-to-day health outside of feelings of stress and exhaustion and fatigue?
I'll start. I think that like the sleep mechanism is usually one of the first things that gets compromised by that. I think that's really common, especially when we have that weird pattern going on where cortisol is being raised in the evening. As soon as that sleep gets compromised, there's a really bad downstream effect because, as I mentioned earlier in the call, the rising of growth hormone, melatonin, melatonin's a really potent antioxidant. Between the hours of 10 p.m. and 2 a.m., you may have heard people say that that's a really important time to be asleep. Usually melatonin takes about 12 hours to reset, right? So if you get out of bed at like 6 a.m. or 7 a.m., that same time PM is when the melatonin system is resetting. And our brains go into a certain depth and we get that deep sleep, quote unquote. And that's where the pituitary gland will pulse growth hormone, right? So we've got all of these beautiful restorative mechanisms in place. And as soon as that cortisol is dysregulated, we're not getting that theta brainwave. We're not getting that detoxification that's supposed to happen. And we're not getting the restoration from things like growth hormone. So I think sleep is one of the first things to go. What would you add to that, Dr. Varden?
Oh, well, okay. So if we're throwing in, say, some physical symptoms, all right, we've mentioned this, weight gain, especially around the abdomen. You'll see that, like that tire that starts to, be more present. High blood pressure, high blood sugar levels, even weakened immune system or a weakened immune response, even that can lead to more frequent infections, getting sick more often. You had mentioned about sleep disturbances. I know I had mentioned about insomnia, especially when you have that pattern flip-flop. Okay. Also, it can actually start looking into even increased bone loss, especially because the nutrient deficiencies or malabsorption, not getting that, especially over a much longer period of time, and this is definitely more in the chronic realm, that it can affect, the integrity of the bones. Thinking more into mental. So increased anxiety, irritability, depression. Actually, I saw in the chat, I think it was Julia had mentioned, she's saying 7 p.m. every night, she can't handle being spoken to. She's like, done. I'm just done. She doesn't have the patience anymore by that time. And I mean, so that, it's looking at going, okay, so you are hitting a point of that irritability, that anxiety. So your depletion, that's the time period. So these are the kinds of things that can come up. Also working into like that poor memory, difficulty concentrating. And this is where like the brain fog comes in, but definitely working more into those long-term risks. So like I had mentioned about, bone loss, integrity, over a long period of time, this is going to show up in increased risk of cardiovascular disease, type 2 diabetes, that HPA axis dysregulation. Your body is screaming at you. You need to start listening. It's asking for change, because if you are in this state or any of these states that we have talked about, then what you're currently doing is not working. So this is where you need to stop and start listening to your body and start making some changes. And it's not saying that I'm not wanting to put, like a slap on the wrist. It's not that. We all go through it. I've gone through it too. You have to give yourself that space of forgiveness. Going, okay, I haven't been taking this good care of you. Now it's time. And it's okay.
Yeah. And I think it's always to really good ends, because I think some of the things I didn't hear mentioned, right, is everyone wants to live well and live long, right? And stress is a cause of cancer. And I don't say that in an inflammatory way. I'm meaning to like create fear. That's how I mean inflammatory there, right? It's just something that wears away at the body's ability to take care of itself, right? when we talk about longevity too, we talk about the wear and tear on DNA, right? And the wear and tear just simply of the body to be able to exist. And this is where it ties into. So I like the idea not only of stress and some of this stress regulation being a signal of maybe something needs to change, right? But this change being something that ultimately seeds better health and better joie de vivre, right? What's the point in, dancing with your body if you're not enjoying the dance?
Yeah, and it's the yin and the yang, right? Because it's like I think our body really strives for balance in so many ways. I mean, I'm gonna get that word homeostasis tattooed on my forehead because I seem to say it every single webinar, but it's because it applies to every topic. Wouldn't that be beautiful? The yin and the yang, right? I mean, we talk about cortisol as being the daytime catabolic hormone. The day is a catabolic time. It's the time where we got to get off our asses and get things accomplished. Then nighttime is anabolic, right? So we've got that yang energy during the day. That's what it's for. And then we've got the yin. The Chinese made the yin and the yang 2,000 plus years ago for a reason. I believe it translates to anabolic and catabolic activity in the body, sympathetic, parasympathetic. The body has this need for homeostasis. And I think that the real breakdown happens when we've got out of that for too long and we become cortisol dominant. We become way too sympathetic in our life. And then we just don't find that time to restore. So I think that a lot of disease really stems from that loss of homeostasis over the timeline.
Yeah, no, I love that. So I wonder if we could gently transition before we take some of the questions that people have been offering us. I wonder if we gently transition to, what are considerations people can make when they're trying to reduce cortisol? And let's be very specific insofar as, if you're someone who is, who really experiences rest through movement, or if you're someone who really experiences rest through quiet, or if you're someone, let's offer different strategies for different sorts of people. Because again, I hate when people are like, oh, you're stressed, you should meditate, as if that's a cure-all for everyone. So maybe, let's go around and offer different strategies for different effectively personality sorts. I think we haven't done a huge service to the genes, right? Genes really can support. So feel free to toss in some genes here as you're speaking to some of the stress supports. There we go. We're close. But what are ways that you guys suggest or offer to your clients, to your patients, to reduce some of that cortisol in a long-term meaningful way, or maybe even in the moment, right? You see that proverbial bear, which is really just a thought in your head. What are ways that you can calm down in the moment?
Can I start on this one, Dr. Laura? Because just so you don't steal what I'm about to say. Because
Lara's got an arsenal. It's good.
No, Laura will be fine, I'm sure. So Dr. Laura and I actually interviewed one of our friends, Dr. Patrick Porter, on one of these webinars. And I will not forget one of the things that he said. He talked about how many thoughts we have in the day. I think he said we have 80,000 thoughts per day, and almost all of them are negative. Right? Mm-hmm. It's a really crazy thing. And negative doesn't have to be that guy's a jerk off. It can be just generally, it can be negative in general, right? It can be thinking about finances. It can be thinking about the state of the world, politics, whatever. But almost all of our thoughts at a baseline are negative. And what he said was, if you view things as challenges instead of threats, right? Like if you can just frame it in that way, you've got a way better outlook and you're actually talking yourself into things. I'm reminded of Michael Jordan. Before he would take a shot, he would tell himself and he would visualize it going into the basket, right? He would actually actively say, this is about to go in. Brain, this is what's about to happen. And he would take the shot, lo and behold, it would go in. So the convincing of yourself, almost self-hypnosis about positive dialogue throughout the day, I think that really pulls the goalposts back on you so you can score a little bit easier when it comes to cortisol regulation. I think it's way worse when we think negatively about our circumstances. So just remember that. Look at it as a challenge, not a threat, and things will start to transform for you.
Yeah. And to offer a little bit of neurocognitive computer behind that, right? The idea is that we as humans, we can't take in all the stimulation around us. And even if we could, right, we're still having to conceptualize it, right? You see something before you, if I'm looking at my hand, I am thinking hand instead of being like, okay, I see this blob with these colors, right? We identify things. And so when you start to work towards the end of a positive framework, right? To the end of let me have that, you prime the way you see things. You prime the way. So you have really two options truly. And this is a muscle, right? This isn't something you wake up and decide this is what's going to happen. This is a muscle you exercise like all the other muscles, right? By adopting more of a positive or challenge forward network, right? You exercise the muscle of the way I perceive this thing before me is going to be more positive, and that will naturally then not lend to that more fearful, threat-based neural cascade, right? This is the mechanism where thoughts quite literally impact biology. It's a little bit more complex, but I really want people in this webinar to hear, to Justin's point, to what Dr. Lara is going to offer in a little bit. This is an exercise and a practice. And if you think that you can think your way into it insofar as tomorrow you're like, I'm only going to think positive, you're setting yourself up to an extent for failure, because it's a muscle you have to exercise. I go to the gym once a month and I'm like, I'm going to do it more. But that first time that I walk into the gym and I lift my weights, the next day hurts a lot. And that's because I'm not exercised. But if I keep going back and I keep moving those muscles, it hurts less and it becomes more natural and it becomes an automatic thing because you've exercised your muscle in that way. So I really, if people are going to work towards this positive mindset, keep that in mind. It's a muscle and you don't get to give up. The important part is getting back up when you inevitably have a slip up because you're exercising a new muscle.
And speaking of exercising and using a new muscle, I have several clients, and me personally as well, I do fall into this. When I get stressed, anxious, whatever, I clean. It's like, I'm stressed out if my house is spotless, or if I have company coming over. But it's really, when you're talking about cortisol, you're talking about this, glucose release. Remember, I had mentioned gluconeogenesis in the beginning. That glucose has to go somewhere. Muscle is a great glucose sink. Use it. With meditation, I can't seem to shut off my little monkey brain. And, I constantly have to, rein it back in. I actually find it more relaxing doing walking meditations. Mm-hmm. I go for a walk. I go on a hike, being outdoors, having, that Shinrin Yoku, the forest bathing, okay, getting so many different benefits, the grounding, exercising outside. I love being barefoot outside in the grass, or, and doing some yoga and stretches and really working my muscles. I know my daughter loves to run. She loves to go to the gym. That's where she gets her, frustrations and everything else out. So doing something physical, can be very helpful for people. Yeah. Something in the moment. Say you are, this is coming up, in a store waiting to check out. Okay, Christmas time, everybody, the queue is like around the corner and you're waiting and you've got places to be and things to do and lots of presents that you're having to purchase. And we tend to get a little bit more irritated. And so something that can help is the realignment of the nervous system of the two hemispheres of the brain by, putting your hands out, thumbs down, left hand over right, lacing your fingers, bringing it up and just resting your hand on your chest. And, you can stand there and you may look a little strange, but so what? But in that, it helps to reorganize the nerves and the systems of the brain. And as long as you don't fall over, you can actually put your left foot over your right, the ankle, and stand there. I've done that before. Like I said, I look a little weird, but I really don't care. So it
beautiful
works.
Thing. Yeah.
Even doing some tapping, some EFT, again, if you are somewhere, that you can't, take a moment, close the eyes, do some breathing exercises, or you don't have your brain tap, handy, or, you don't have a heart math device handy or whatever. You can just do some tapping. There are certain spots like on the hand that you can tap, or even, on the face, on the head. Again, it may look a little strange to some people, but if it's helping you, who cares? Let it help you.
Yeah.
Again, there are so many different things that can be done in the moment, but that can also be done to help have that relaxation. But this is where that personalization comes in. As we practitioners get to know the client sitting in front of us, knowing their stories, knowing, what they like, what they don't like, looking at their, genetic profiles and how they process information, finding those techniques and also things that they have done in the past that have worked.
Yeah.
Let's revisit that. So think back for those audience members, when you get stressed, when you do that, think back to a time that things were joyful, that you were calm, okay? Or that you were a little bit stressed, you did something and it helped. Put your mindset in that joyful place. Think of that. Amazing, the biometrics that change, the brain rhythms, your heart rhythm, everything, just thinking of that joyful time, okay? But then starting to implement some of the techniques that have worked for you in the past.
Yeah.
You know a lot more than you think you do.
I love that. I think just to the end where we have data that demonstrates a negative thought can increase cortisol, right? The same power is true on the positive side. There is brain imaging evidence that positive thoughts can shift the biophysiology of the body. And that's really to that end of shifting perspective, and then separate to that, really having extra, that the more positive thoughts, even if it is just dropping into your mental safe space, right? That can shift the biochemistry of the body. I've seen within the chat, I really appreciate, Jihan, I'm not sure if I'm saying that correctly, but I appreciate within the chat, scattered amongst the, oh, I exercise, or, oh, I listen to music, or I do this and that. I really value that there's the honesty of, when I'm stressed out, I eat, and I'm totally part of this club. Food is my best friend. But I would offer, but that spurred a thought within me. So I do want to take a moment to speak to some of the females, or in particular people who have periods in our audience. And I'll make a comment for myself, right? My stress coping techniques change through the course of my cycle. The first half of my cycle, if I'm stressed, I need much more of a physical outlet. So I need the gym, or I need walks, or I need to go punch something, right? There's a physical outlet for that first portion of my cycle. Whereas the second, I need something a little bit more gentle, right? And part of that gentleness is definitely food. I think we can't throw baby out with the bathwater. Proper food is a stress management technique. And so I say this to the end of not focusing exclusively on those people who are menstruating, but more to the end of, your stress technique may not be consistent either throughout the month or separate to that throughout the course of your life, right? Justin, you can speak so beautifully to the male experience, namely that I would imagine stress techniques that worked for you when you were 20 are not necessarily the stress techniques that you're using now, nor, if you have a 50-year-old man in front of you, are those the stress techniques you're suggesting for them. So I really encourage people to be continually curious around this, because for me, over the course of a month, mine changes. For the course of a woman, from when you're menstruating to not, that's going to change. And then for a man, especially decade over decade, that's going to change. And this is that individualization of our medicine and of work with your practitioner that's so very important. And it's okay if you thought once upon a time it worked and it no longer does. Just means you different, just means time passed and your body's doing what your body's doing.
Yeah, and we also, the tendency for males would be that default aggressive thing. And I like a lot of what we're saying as far as this capacity to, like, if you can't think your way into positive action, then you can act your way into positive thinking. I really think that emotions are energy in motion, and sometimes we have to get out of our head and get into our body The problem is that you can get into a state where you just overtrain as well. And as you know, for males, as we age, you can't just do that, right? Like you're going to have an impact on testosterone and things. So what I recommend is there's this concept of working in versus working out. You know, a gentleman named Paul Sheck talks about this, who I'm a big fan of. And you're getting into your body either way, but sometimes you need to add in some more restorative stuff. And I think guys have a weird thing where we don't want to do that. If we're going to work out, we want it to be a bombastic grinding session and slamming weights and slamming punching bags and doing that whole thing. And that's great. And we need that as well so that we don't murder stuff. But I think that it's okay to also go for a walk if you're a guy. It's okay to do a stretching, a mobility session if you're a guy. Yeah. So don't be afraid to work in. You can work in and you can work out. And as, a 20-year-old versus a 60-year-old, you're going to have to transition a little bit more towards that working in phase. And that's okay too.
Yeah. Yeah. And blasting some music and dancing.
Yes.
Yes. Yes. I like that answer. Yes. All right. I think this here reaches the end of this wonderful little webinar. To those that held on to the very end that were looking for some more in this conversation or support, thank you so very much. We value, and I think a lot of it is caregivers, right? Because that can be a source of high cortisol. And so we hear you, we see you, and we're going to ensure that we offer that offering. So to our caregivers, both of whom are panelists here tonight, who show up in life in beautiful ways, both for others and for self. Thank you. Thank you for the offering to others, especially this evening. Thank you for sharing your wisdom and knowledge. To everyone who also showed up, thank you. We're grateful to our community. All y'all are wonderful. So thank you. I'm grateful for you as we shift into American, or as Canadians put it, alternative Thanksgiving. The other Thanksgiving. But that's okay. I hope everyone has a most wonderful Thanksgiving. I hope you enjoy the family and friends and whoever your community is that you show up for and enjoy time with. All right, we're going to dance out. Thanks, everyone. Oh,
bye.